When you think about our TSA agents, you probably picture, security lines, maybe the occasional dramatic security incident. But beneath all that visible pressure, there's a hidden physical toll. The job demands constant movement, heavy lifting, and just standing for hours, often in a really fast-paced environment with very little room for error. Today, we're doing a deep dive into workplace injuries among TSA employees. Yeah, from screeners to baggage handlers and even the administrative staff. Our mission for this deep dive, well, it's to unpack the common types of injuries they face, the critical immediate steps you need to take after something happens, and the essential guidelines for choosing the right medical professional. All of this is really to ensure you're fully informed and, well, empowered to navigate the federal workers' compensation system, specifically OWCP, that's the Office of Workers' Compensation Programs, should you ever need it. Okay, let's unpack this. So to kick us off, here's a surprising fact that really puts things in perspective. TSA employees face one of the highest injury rates in the entire federal workforce. Get this. In 2017 alone, TSA reported 1,813 work-related injuries and illnesses. That placed them 8th highest among all federal agencies. And some analyses, they estimate an astonishing 16% annual injury rate for screeners. I mean, far, far above the typical, 4.5% federal average. This is a staggering number. Why is this the case?
It really does highlight the unique and often unseen demands of their role, the very nature of TSA work, from the constant repetitive strain of lifting heavy luggage and equipment to prolonged periods of standing, operating complex machinery, and even the inherent stress of dealing with security threats. All of that contributes to several distinct and unfortunately very common injury categories. It's just a physically demanding job in ways many people probably don't fully grasp.
Yeah, that makes a lot of sense. When we talk about the nature of their work contributing to this, what are the most common injuries we're actually seeing, and how does the federal system, OWCP, classify these? Because that seems pretty vital for getting a claim approved, right?
Absolutely. That classification is crucial. It literally dictates which official federal form you need to file. So let's start with slips, trips, and falls. These are quite common in those busy, crowded airport environments. Wet floors, unexpected obstacles, bags left places. They can result in immediate injuries like sprains, maybe an ankle or wrist or knee injury, sometimes even fractures. And because these are sudden, one-time events, clearly identifiable by a specific time and place, they are classified as traumatic injuries. For these, you must file a Form CA-1. That's the Federal Employee's Notice of Traumatic Injury. Think about tripping over a passenger's bag during your shift and twisting your ankle right then and there. That's your classic CA-1.
Okay, CA-1 for sudden one-off events. Got it. What's next?
Next up, and honestly a leading cause, are overexertion and lifting injuries. Moving heavy baggage, equipment, it's constant. And back strains are especially common here, making up roughly maybe 20% of TSA injury cases. Now, here's where that classification really matters again. If the injury comes from a specific incident, like you felt a sharp, acute pain in your back right as you hoisted one single heavy bag, that's a traumatic injury.
So another CA-1.
Exactly, another CA-1. And it's interesting, those mechanical baggage systems, they were introduced specifically to try and reduce these kinds of acute lifting injuries. However, if it's more of a cumulative stress injury, think chronic back pain or joint degeneration that develops from repeated lifting, maybe over months or even years, that's considered an occupational illness. For those, you file Form CA-2. That's the Notice of Occupational Disease.
Okay, so the difference is key. Sudden lift pain is CA-1. Gradual back problem from months of lifting is CA-2.
Precisely. It's all about the timing and how it developed. Then there are repetitive strain and ergonomic injuries. These stem from those consistent, repeated motions involved in TSA screening work, moving bags on belts, operating X-ray machines, doing pat-downs, or even just, extended periods typing up reports. Conditions like carpal tunnel syndrome, maybe tendinitis, or chronic knee and foot pain fall squarely into this category. And since these conditions develop over more than one workday, often kind of subtly over weeks or months, they are classified as occupational illnesses.
So that means Form CA-2 again.
That's right, Form CA-2 again. This is clearly distinct from, say, an abrupt one-time twist of the wrist while handling a bag, which, as we said, would be a CA-1.
Makes sense. What else is common?
Well, we also frequently see injuries from being struck by objects or equipment. I mean, when you're working around all that luggage and machinery, it happens. Staff can be hit by falling bags or bumped by passing carts. Hand and finger injuries are quite common too, maybe around 15% of TSA injuries. Often from catching fingers in equipment or maybe contacting sharp objects inside baggage. These are clearly sudden accidents, right? So things like contusions, cuts, or broken fingers from being struck are filed on Form CA-1 as a traumatic injury. Just picture a heavy suitcase falling off the belt directly onto a TSO's foot. That's a clear CA-1 scenario.
Right. Sudden impact. Traumatic.
Yeah.
CA-1.
Exactly. Then there are cuts, lacerations, and exposure incidents. This could be from sharp objects or maybe needles concealed in luggage or even a one-time exposure to chemical fumes, perhaps from a leaky container, a single exposure to a toxic chemical, or a one-time needle stick. That's considered a traumatic injury. CA-1 again. However, if it's a health condition that develops from prolonged exposure, like, say, gradual hearing loss from long-term noise exposure near the screening machines, that would be an occupational illness.
Dreams.
Form CA-2. Again, it comes down to that one-time event versus developed over time distinction. It's the core concept. And finally, unfortunately, we have to mention workplace violence or security incidents. TSA officers can, sadly, suffer injuries from assaults by unruly passengers or even, in rare cases, targeted attacks. These are, well, by definition, traumatic injuries because they occur in a particular identifiable incident. So they were reported on Form CA-1. And importantly, this even includes psychological conditions like PTSD if they result directly from a single violent event or a credible terror threat. The precipitating event is clearly identifiable.
Wow. Okay, so that covers a wide range.
It really does.
Yeah.
And the fundamental distinction here is just so vital. I have to stress it again. Form CA-1 is for conditions caused by some external force or event during one single work shift, while Form CA-2 is for conditions produced by work factors over longer periods, more than one shift. Filing the correct form is absolutely paramount. It's critical for your claim to even be considered, let alone accepted by OWCP. Misclassifying your injury isn't just a minor error, it's often the fastest way to get your claim delayed or, frankly, denied.
Okay, that distinction between CA-1 and CA-2 is crystal clear now, and it really underscores how crucial it is to correctly identify the nature of your injury right from minute one. Here's where it gets really interesting. Speaking of getting it right, let's talk about those critical immediate steps you need to take when an incident actually occurs. So, you're injured on the job. What exactly do you need to do, and maybe more importantly, when?
Right. Prompt action is indeed essential. Because the Federal Workers' Compensation System, OWCP, it has very specific procedures and, crucially, timelines that you absolutely must follow to protect your rights and your benefits. First and foremost, report the injury immediately. You need to notify your supervisor as soon as the injury occurs or as soon as you become aware it might be a work-related condition, like with those gradual onset things. Ideally, this should be done the same day, at very least within 24 hours. And your supervisor. They must provide you with a receipt of injury notification right there on the spot. Don't leave without it. This early reporting is just crucial for timely processing and, as we'll get into, for certain benefits like continuation of pay.
Okay, immediate reporting. Step one, what's next?
Second, seek medical attention and get authorization. Obviously, for serious emergent injuries, get care immediately. Call 911 if needed. Don't hesitate. And always, always tell the medical provider that the injury is work-related. That's key for billing and documentation. For non-emergencies, you still need to see a doctor as soon as possible. Don't wait. And here's a really crucial detail. Specifically for those traumatic injuries, the CA-1 cases, you should request Form CA-16 from your supervisor. That's the authorization for examination and odor treatment.
CA-16.
Yes.
Wow.
And the rule says the employer shall issue this form within 4 hours of your initial report. That's pretty quick. If they give you verbal authorization first, maybe over the phone, a written CA-16 must follow within 48 hours. This form basically guarantees payment for your initial medical visit, takes that worry away. Just be aware, though, a CA-16 is generally only issued for injuries reported within 7 days of occurring. Another reason not to delay reporting.
And what about for the occupational illness, the CA-2 cases? Is it different?
Yeah, for CA-2 cases, prior OWCP approval is usually needed for medical care, since it's not an emergency. The CA-16 isn't typically used there. But regardless of CA-1 or CA-2, the advice is, do not delay treatment if you need it. You can seek care and just inform the provider that the OWCP paperwork will follow. Your health comes first.
Good advice. So report immediately, seek medical care with the CA-16 if it's traumatic. What's step 3?
Third, document the incident and gather evidence. While the details are fresh in your mind, write down exactly how the injury happened. Note the time, the date, the specific location, the sequence of events leading up to it, and really importantly, the names of any witnesses. If there's any kind of airport or security incident report generated, try your best to obtain a copy for your records. And if it's safe to do so, maybe take photos of any hazards that contributed to the injury, a wet spot, an obstacle, faulty equipment. This documentation can be invaluable later on.
Makes sense. Get everything down on paper quickly. Then what?
Fourth, Complete the appropriate OWCP form, either CA-1 or CA-2. You, the injured employee, must fill out your portion of the form. Don't rely on someone else to do it for you. And be thorough and accurate. Describe the injury clearly, explain exactly how it occurred, and list precisely which body parts are affected. For instance, don't just say, hurt my back. Say something like, strained lower back, specifically the right side, while lifting a heavy passenger suitcase estimated at 60 pounds on October 5th, 2025, near Checkpoint B.
Be specific.
Extremely specific about the work factors involved. Vagueness doesn't help your claim.
Okay, so given all these steps, reporting, medical care, documenting, filling out the form, what does this all mean for the speed of filing? How fast do you really need to be?
It means timeliness is critical. I can't stress that enough. For a traumatic injury, filing that CA-1 within 30 days is absolutely essential. Why? To preserve your entitlement to something called continuation of pay, or COP. That's a huge benefit we definitely need to talk more about in a moment. Now, technically, OWCP generally requires a claim to be filed within 3 years of the injury date.
3 years seems like a long time.
It does, but filing it immediately or as close to immediately as possible is always the best practice. It avoids complications, potential disputes, and it prevents anyone questioning why there was a delay in reporting. Just get it done quickly.
Okay, file within 30 days for CA-1 to protect COP rights, but ideally file right away. What else?
Fifth, notify your employer in writing and keep copies. When you give the completed form, your CA-1 or CA-2, to your supervisor, make sure they sign and date it acknowledging receipt. And you absolutely need to get a signed copy back for yourself. That's your proof. Always keep copies of everything you submit, the CA-1, the CA-2, the CA-16 if you got one, and copies of any letters or correspondence you get from your employer or from OWCP. This is your personal, crucial record of the entire process. Don't lose it.
Got it. Keep meticulous records. And what about the agency's responsibility?
Right. Finally, regarding supervisor and employer actions, your agency, your employer, is legally required to forward your completed claim form to OWCP within 10 working days of receiving it from you.
10 working days.
Yeah. Yes. And they absolutely cannot interfere with or delay your claim submission. They have a duty to forward it promptly. It's probably wise for you, the employee, to follow up if you don't receive a claim number acknowledgement from the Department of Labor within, say, a couple weeks after you submit the form to your supervisor, just to make sure it got sent and received.
That's a really practical tip. Okay, that covers a lot of crucial immediate steps and timelines. And you mentioned a really significant benefit called continuation of pay. Can you tell us more about that? Why is getting that CA-1 within 30 days so important for COP?
Yes, continuation of pay, or COP, is an immediate and very important benefit. But here's the key thing. It's only available for traumatic injuries.
Only for the CA-1 cases, then?
Exactly. Only for CA-1 cases. What it does is it allows your regular pay to continue for up to 45 calendar days of work absence that's directly due to the injury. And importantly, this happens without charging your sick leave or your annual leave.
Ah, so you don't burn through your leave time while you're initially out?
Precisely. It's designed specifically to bridge that financial gap while OWCP is evaluating your traumatic injury claim. Now, to qualify for COP, you must do two things. One, report the injury and file that CA-1 form within 30 days of the injury occurring. And two, you have to submit medical evidence supporting your disability, basically. A doctor's note saying you can't work because of the injury within that 45-day COP window. And those 45 days don't even have to be consecutive. They're like a total bank of days you can use as needed for that injury.
So it's essentially like a temporary paid disability leave specifically for those sudden identifiable injuries covered by CA-1.
That's a great way to put it. Now, this is also crucial. COP is not available for occupational disease claims, those CA-2 cases that develop over time.
Right, you mentioned that distinction earlier.
Yes. So if you have a CA-2 claim, like carpal tunnel from repetitive motions, and you miss work, you'd typically have to use your own sick or annual leave, or perhaps go on leave without pay. Then, once your CA-2 claim is eventually approved by OWCP, you can file another form, a CA-7, to claim wage loss compensation for the period you were out or for the leave you used. But it's not automatic upfront pay like COP.
Okay, so COP is a major advantage for those CA-1 traumatic injury claims. Is there any catch?
There is one critical caveat you need to be aware of. If OWCP investigates and later denies your traumatic injury claim, maybe they decide it wasn't work-related. After all, any COP that you received may be charged back to you.
Charged back? How?
Meaning, the agency could require you to use your sick or annual leave retroactively to cover the time you were paid COP. Or in some cases, you might even have to pay it back out of pocket. So while COP is great, the claim still needs to be ultimately approved.
That's really important to know. Okay, so beyond COP, what about the ongoing medical side?
Right. Medical documentation and OWCP notifications are continuous throughout your claim process. It doesn't stop after the initial visit. After any initial urgent care, your chosen doctor must provide detailed medical reports directly to OWCP. These aren't just simple notes. The report needs to include your specific diagnosis, the treatment plan, prognosis, and very importantly, a clear medical opinion linking your condition directly to the specific work event or work duties. For a CA-1, a clear statement like, based on the history provided and my examination, it is my medical opinion that the patient's diagnosed ankle sprain on date was directly caused by the reported incident of tripping over a bag at work, is crucial.
So the doctor needs to explicitly connect the docs for OWCP.
Absolutely. For CA-2, the occupational illness, the doctor needs to go even further and explain how the specific work factors, like repetitive lifting over months or prolonged standing, medically resulted in the diagnosed condition, like degenerative disc disease or carpal tunnel. Your supervisor might also give you a form CA-17. This is a duty status report. You take it to your doctor, they fill it out, detailing any work restrictions you might have because of the injury, like no lifting over 10 pounds or limited standing to 2 hours at a time. This helps the agency see if they can offer you suitable light-duty work. And, again, most importantly throughout this whole process, meet all the timelines OWCP gives you for submitting paperwork or any additional evidence they request. They will send you formal letters outlining exactly what is needed and by when. Missing those deadlines can jeopardize your claim.
Okay, so just to quickly recap those key timelines for everyone listening and really hammer home why they matter. You report to your supervisor the day of the injury, ideally filing your CA-1 or CA-2 immediately. You seek medical care within 24-48 hours, and if it's a traumatic injury, you get that CA-16 authorization to ensure the initial treatment is covered smoothly. You make absolutely sure you file that CA-1 within 30 days to preserve your right to those 45 days of continuation of pay, which is vital for your immediate financial well-being. Your agency then needs to submit your completed claim form to OWCP within 10 working days. And while the overall claim filing limit is technically 3 years, immediate meticulous action at every single step is clearly expected and is what best protects your benefits. It's clear that following these protocols isn't just about, checking boxes for compliance. It's really about building an ironclad case right from day one. Now, let's shift gears slightly. You've done everything right with the forms and the reporting timeline. Fantastic. But here's the next really critical piece. How do you choose the medical professional who's going to guide your recovery and ensure your claim remains valid in the eyes of OWCP? This is where your rights really come into play, isn't it?
Precisely. This is a fundamental right. Under the Federal Employees Compensation Act, that's FECA, injured federal workers have the absolute right to choose their own treating physician for a work injury. This choice is incredibly vital, not just for your physical recovery, but also for ensuring your workers' compensation claim stays valid and that you get the best possible unbiased care. You're not stuck with whoever the agency might suggest.
Okay, so you get to choose.
Yeah.
But who qualifies? Can it be just any doctor?
Good question. So OWCP has specific definitions. An OWCP-eligible physician primarily includes medical doctors, MDs, and doctors of osteopathy, DOs. It also extends logically to podiatrists for foot injuries, dentists for dental injuries, and clinical psychologists for diagnosed work-related mental health conditions. For most typical TSA injuries, which, as we've discussed, often involve orthopedic or musculoskeletal issues, backs, shoulders, knees, wrists, a good choice might be your regular primary care physician, if they handle OWCP, or maybe an orthopedic specialist, an occupational medicine specialist, or even a neurologist, depending on the issue. The main requirement is that the physician must be licensed to practice in the state where they're treating you. Now, while it's not strictly required by OWCP, having a doctor who has some experience with federal workers' comp cases can be a significant benefit. Why? Because they're usually more familiar with the specific, sometimes detailed, documentation requirements OWCP demands.
Right, they know what OWCP is looking for in those medical reports.
Exactly. They know how to phrase the causation statement, how to detail work restrictions properly on the CA-17, things like that.
Okay, MDs and DOs are the main ones. What's fascinating here, though, is the specific and maybe somewhat surprising limitations on chiropractors. Can you elaborate on that? Because I know that can be a point of confusion for a lot of people with back injuries.
It's a very important distinction, and yes, it often catches people off guard. It's based directly on the federal law governing FECA. The law provides a very specific and frankly quite limited definition of when chiropractic care is covered by OWCP. A chiropractor is legally recognized as a physician only for the treatment of something called spinal subluxation, basically a misalignment of the spine, and critically, that subluxation must be demonstrated by an X-ray.
Okay, so you need X-ray proof of misalignment for OWCP to even consider covering chiropractic treatment.
That's correct. What this means in practice is that OWCP will only pay for chiropractic treatment if an X-ray actually shows a spinal misalignment, and the chiropractor is treating that specific subluxation through spinal manipulation. Chiropractic care for other issues like general back pain without X-ray proof of subluxation or problems with extremity joints like shoulders or knees is not payable as primary treatment under OWCP rules. Furthermore, a chiropractor generally cannot sign off as your main attending physician for OWCP purposes, especially for non-spinal conditions. They can provide adjunctive care if ordered by an MD or DO, but not usually be the primary manager of the claim.
Wow. So the bottom line for our listeners, what? If they have back pain and like their chiropractor,
The bottom line is this. While chiropractic therapy might indeed be helpful for your back pain, and you might get relief, you should still officially designate an MD or a DO as your primary attending physician for your OWCP claim. This ensures your overall claim eligibility and allows for broader treatment options like physical therapy, medication, or specialist referrals to be covered if needed. You can potentially still see the chiropractor if your MDDO prescribes it as part of the plan, but the MDDO needs to be in charge of the OWCP case.
that's a really crucial piece of advice. Okay, so choose an MD or DO. What about doctors suggested by my agency?
Right, here's some more crucial advice. Avoid agency or employer-provided doctors for your primary care. Remember, federal employees have the freedom to select an independent doctor. Your employer cannot direct your care or insist you see a specific doctor for treatment.
They can't force you to go to their clinic.
Not for your ongoing primary care related to the injury, no. They might direct you for an initial first aid assessment right after the injury. Or OWCP itself might later send you for a second opinion exam with a doctor they choose, but you choose your main treating physician. And because of that choice, we strongly recommend not choosing a Veterans Affairs VA doctor or your agency's own occupational health clinic doctor as your primary physician for an OWCP claim.
Why is that? Is it a conflict of interest thing?
It's partly about ensuring there's no potential conflict of interest, yes, but it's also practical. OWCP generally has rules against paying one federal agency, like the VA or your agency's clinic, for treating another federal agency's employee under FECA. Billing gets complicated. Plus, the VA's primary mission is veteran care. They might not be set up or focused on handling the specific requirements of OWCP claims. So the better route is usually to opt for a private sector physician, someone in your community who is willing and able to handle OWCP paperwork and billing.
Okay, so look for a private MD or DO. How do you know if they're OWCP approved or willing to handle these cases? Is there a list?
Yeah, that's a common question. There isn't really a formal list of pre-approved OWCP doctors you can look up. But the key requirement is that the doctor you choose must be willing to register with OWCP's online billing portal, which is run by a contractor, and they must agree to accept the Department of Labor's payment schedules, which might be different from private insurance rates. So the best advice is simply to ask directly when you're calling to make an appointment. Just say something like, do you treat federal workers' compensation cases under FECA, and are you willing to complete the necessary OWCP forms and billing?
Just be upfront about it.
Exactly. Be upfront. Some providers might even advertise themselves as OWCP certified or DOL OWCP providers. That doesn't mean they have a special certification from OWCP, but it usually indicates they have experience with the system and understand the protocols, which can be helpful.
Good to know. Without needing a specialist.
Right. Understand the role of specialists and referrals. You absolutely can choose an appropriate specialist as your initial treating physician if your injury clearly warrants it. For example, if you have a serious hand injury, you could choose a hand surgeon right from the start. Or for a severe psychological reaction to a workplace incident, you could choose a psychiatrist. And generally, OWCP will pay for referrals to other specialists or for things like physical therapy, occupational therapy, diagnostic tests like MRIs, as long as they are medically necessary, directly related to your accepted work injury, and prescribed or ordered by your primary attending physician, the MD or DO managing your case.
So the primary doctor needs to order the referral.
Correct. However, there's an important restriction here, too. Non-physician providers like physical therapists, physician assistants, PAs, or nurse practitioners, NPs, cannot independently manage your OWCP claim. Their valuable services are definitely payable, but only if they are ordered and supervised by your attending MD or DO. They can't be the designated attending position on your OWCP forms. Also, just as a side note for objectivity, OWCP generally prefers that family members do not serve as your treating physician, as their impartiality might be questioned.
Okay, that makes sense.
Oh,
MD or DO in charge, referrals okay if ordered. What if I start with one doctor and, well, it's not working out?
good point. You do have some flexibility. Regarding a change of doctor, the rule is you have the right to change your chosen treating physician one time relatively easily, just by notifying OWCP in writing of your new choice. If you want to change doctors again after that first change, subsequent changes usually require prior approval from OWCP. They might want to know why you need another change. So, that initial choice is important, but you do have one opportunity to switch if needed without too much hassle.
Good to have that option.
Definitely. So if we connect this all back to the bigger picture, choosing an appropriate, independent, licensed physician, ideally an MD or DO who understands or is at least willing to learn, the OWCP documentation requirements is just paramount. It's absolutely fundamental for maintaining your claim eligibility, getting the proper care authorized, and ultimately for your successful recovery. It's a foundational piece of navigating the entire OWCP process effectively.
Wow. What a comprehensive journey we've taken today. Seriously. We went from understanding the, frankly, quite high and unique injury risks that TSA employees face every day to really digging into that absolutely vital distinction between immediate traumatic injuries needing a CA-1 and those longer developing occupational illnesses needing a CA-2. Then we walked through meticulously following the OWCP protocol, the reporting, the medical care authorization like the CA-16, the documentation, the critical timelines, especially for COP, and finally, making those informed choices about your medical provider, know your right to choose, and understanding the nuances, like with chiropractors. It really underlines how much an individual needs to know to protect themselves.
Exactly. And, gaining this knowledge, understanding these steps and rights, it truly transforms what can seem like a really daunting, opaque, bureaucratic process into something manageable, into an actionable plan. It genuinely empowers you, the listener, to navigate these potentially complex and stressful situations with much more confidence and helps ensure you receive the benefits and the care you're entitled to under the law. Knowledge really is power here.
It absolutely is. And thinking about all this detail, this raises an important question for me and maybe for you listening. Given how incredibly specific and, frankly, vital these procedures are for federal employees when they face workplace injuries, what ripple effect might widespread awareness of these rules have? I mean, beyond just helping individual well-being and leading to more successful claims, could knowing these rules inside and out actually encourage broader safety improvements? Could it foster a more supportive, proactive culture within large federal agencies like the TSA if everyone truly understood the process and their rights?